Well, Paul, I'd like to switch gears for a quickfire segment before we conclude the episode. I've got 5 questions for you. In one word, how would you describe the current state of trust in healthcare?
Say precarious.
It's a good one. That's a good one. I had a feeling you were going to go in that direction. What's the number one mistake healthcare brands make when communicating with consumers?
I would say it's that empathy word again. I don't think we've done a good job of putting ourselves in the shoes of who we're talking to. And that applies as much in B2B as it is in consumer. But I think institutions are just too wrapped up in their own mission and purpose and things. And I think we need to really come at it more from the eyes of the audience.
This one's sort of a trick question. Do you believe social media has more potential to build trust or break trust in healthcare?
Ooh, that's a loaded one.
I know, right?
I'm actually going to say build. And
I'm with you there. I'm an optimist, Paul.
Yeah, I'm an optimist, and I think it just follows people's drift to there. I mean, as it becomes the major place you get news, it becomes the major place you're sharing content. It's the people you follow. You know, if you spend more time watching YouTube videos than watching television, like that's the place where it has to happen. And I see a lot of positive things happening, and I see a lot of backlash to the negativity and a recognition of things like I was actually at a mental health summit last week, and it was talking about teens and social media. And so I think the fact that we're recognizing that and trying to adjust, I think bodes well for where it will go, because it's not going away.
Yeah, I agree with you. I'm curious, does the trust barometer dive into trust you have media as kind of one category. Is social media embedded into that, or do you kind of break that out in its own?
No, we don't get that micro for this. We've definitely done some other studies of different nature where we've sort of understand those dynamics more, but not specifically in the health care realm. But I think I think people's affinity for the content and the personalities in social media is just so much stronger than trying to do so much traditional marketing. I mean, I'm constantly looking, my wife watches all of these YouTube videos and while they're sharing something and she's going, oh, I need to look into that. And I said, boy, if that had been a print ad, it's like, I would have gotten nowhere. Right. But suddenly there's this trust and this interest in this. So I just, we're seeing the affinity that people have for it. And it's really just, I think, mastering it in the right way while constantly eliminating some of the negative things that have happened, which I think all of the platforms are actively working on. I really, I don't want to talk for X at this point. For some interesting reasons.
Fair point. What's the one thing that healthcare brands should stop doing in order to regain trust?
I would say there's a combination of sort of cheerleading and chest beating that happens that sort of implies that the trust and the believability is implicit. And I think sort of it's almost a vulnerability to say, we know this is hard. We know you have challenges. We know that we're trying to figure this out. We know that we don't do this well. We know that the change we're doing, I think being a little more vulnerable in a transparent way, I think would build a lot of trust from people to say, yes, we're on this journey together and we appreciate you acknowledging that. And, there was actually a hospital system here in the Twin Cities a year or two ago that was actually their TV spots were people going through really bad experiences in their hospital. And they're saying, we know, we're working on it, we're trying. And I found it so like the fact that you acknowledge refreshing. It was really refreshing. And I just think the general sense of that acknowledgement versus sort of this very stone institution sort of approach that I think a lot of people still perceive in healthcare.
I would have been very fascinated to sit in the room while they debated and decided whether to move forward with that or not, because you know that they were leaning into this, let's own it. Let's be vulnerable and own it because it's going to win us a lot. It's going to win us a lot. But
they made it genuinely funny, which helped.
True. Done well, it can go a long way. But I think, a lot of brands are scared to go down a pathway like that because it's perceived to be too high risk, right? And there's too much at stake. But I'm kind of at the point of it might be riskier not to at this point, right? I mean, if part of what we're hearing here is it's riskier not to say the things that need to be said and be vulnerable and have high empathy. So go all in.
Yeah, if you're going to take trust seriously, then you're going to both A, be transparent, and be bigger than yourself. So whether that means thought leadership around the industry, or whether that means things that every word out of your mouth isn't directly marketing and benefiting you, but it's adding to the conversation, it's making people feel empowered, it's building a better information ecosystem. We always say action drives trust. That's the key, right? But trust isn't words, it's action. So what are you doing to demonstrate that?
Show me. Yes. Last question. Where do you think the biggest opportunity lies for healthcare marketers in 2025?
I'm really going to come back to connected care, because I think that's so much the promise. And I think so many things that we have right now that we talk about are one-offs. And it's like, I've got this thing at home, and I've got this smart bed, or I've got this device for my diabetes, and they've got this machine in the clinic that did this. And I think people want to make those connections. And that's what we get from every other industry. Bringing this back to the whole industry thing, like when you think about how do I use my Delta Airlines app? How does my bank operate?
Yes.
How does Amazon operate?
Yes.
I think making people feel like healthcare is going to start working more like that, because it's not even close. And it's almost the only industry at this point that is like that. So I think starting to bring that promise together of all these individual things and challenges you want, we're starting to, each individual solution is adding up to a bigger whole. And again, we're doing it with that empathetic eye of making the experience better. And that's not just for patients. Physicians are in crisis, right? Nurses are in crisis. So whatever audience we're looking at that's necessary to make the healthcare ecosystem better, showing how our solutions are going to ultimately add up. I mean, if there's an innovation coming in that, and a physician said, that just means more data that's coming in that I have to look at, I'm just going to be overwhelmed more, then it's not getting us anywhere.
Right. Yeah, no, I love that. I think that's a great point and an important thing for all of us to strive towards.